Gurmagath, Cahirlock and Fáilte Ara, and thank you for coming into the House today. Minister, my commencement matter this morning is seeking an update from the Minister for Health on the proposal to name the new National Children's Hospital after Dr. Kathleen Lynn. The campaign to name the National Children's Hospital after Dr. Kathleen Lynn has been led by the 1916 Relatives Association. It has the support of my own party, Fianna Fáil. It has the support of SIPTU, of Forsa, of Dr. Kathleen Lynn's old alma mater, Alexandra College, and other political parties and other non-political parties, organisations like the National Women's Council. So there is very broad support for the campaign and the proposal to name the National Children's Hospital after Dr. Kathleen Lynn. And Dr. Kathleen Lynn, for those who aren't aware, was not only a medical doctor, but Dr. Kathleen Lynn was a revolutionary, we'd call her a disruptor maybe in modern parlance. She was a pioneer of children's and women's health, and she was a champion of social justice. She was born in Mayo, actually, she's not a dub, but she was born in Mayo back in 1874. She studied medicine, and she was a suffragist. She was involved in both the 1913 lockout and again the 1916 rising. She was arrested, she was imprisoned, she did time in Kilmainham and in Mountjoy, and following all of that, you'd think enough excitement in one woman's life, she went on then to found St Ultan's Hospital, which was the first children's hospital in 1919, really not but a stone's throw from here on Charlemont Street. And in that hospital, she pioneered the provision of healthcare for children and for women, many of whom would never have had access to healthcare, certainly not professional healthcare. And she has a legacy that I suppose today we all enjoy. A tradition she fostered and started a tradition of caring for children, caring for children's health needs, which are particular to children, to their mothers, to women and women's healthcare, which obviously has come a long way but still has so much further to go. She was a woman who provided healthcare to people of a socioeconomic background who would never have been able to access it. She not just championed social justice as a value, she lived it and she made it real. Her legacy is indisputable. Her contribution to our republic, we still enjoy today. We rightly celebrate the fathers of our republic, but there's very few of the mothers of our republic. There's very few women of Irish history who are properly and appropriately commemorated. I believe, and many others believe, that the creation of a National Children's Hospital that will provide best-in-class, absolutely up-to-date, best of quality healthcare for our children is absolutely what our state should be doing. We believe that that care and provision should be informed by the values of Dr. Kathleen Lynn, the values of provision of healthcare based on your health needs, the provision of healthcare based on social justice. Minister, what I would like to hear today is an update from the Department of Health and the Minister on what is the process, where are you in the process, where is the Department in the process of naming the National Children's Hospital after Dr. Kathleen Lynn? Gurmagath.
I would like to thank the Senator Fitzpatrick on behalf of Minister for Health Stephen Doyle for this opportunity to update the House on this important matter. So the Children's Hospital project will truly transform how paediatric care is delivered in Ireland. The new Children's Hospital building is at the heart of this transformation, bringing the acute paediatric hospital service and specialities in Children's Health Ireland under the one roof for the first time, leading to improved clinical outcomes and a better experience for children, young people and their families. This is a much needed and much deserved investment in our children and young people. And for the dedicated staff working in Children's Health in Ireland, we are currently providing excellent care. This much needed reform will support delivery of expert tertiary and higher level care and treatment for all children and young people, who represent 25% of our population, in world-class state-of-the-art facilities where healthcare providers can deliver care leading to better health outcomes. In satellite centres, we are already seeing the benefits of the investment in new Children's Hospital project, with the 2 new paediatric centres in Talon and Connolly helping to reduce waiting times for children and young people and their families. In 2022, over 22,000 children presented to the Urgent Care Centre at CHI at Connolly. More than 92% were discharged home after their visit. There have also been over 15,000 outpatients attending CHI at Connolly. Over 36,000 children are presented to the emergency care unit at CHI at Tala in 2022, with over 4,000 outpatients attending. Both of the satellite centres providing a new model of ambulatory care fully aligned with Sláinte care, ensuring the right care in the right place at the right time. Coming on to the area in terms of the naming. So following the establishment of the matter you specifically are putting forward in respect of your debate today, Senator Fitzpatrick. Following the establishment of Children's Health Ireland on statutory footing in 2009 and the opening of Satellite Centre at Connolly and Tala, Children's Health Ireland sites are currently referred to as CHI at Crumlin, CHI Temple Street, CHI Tala and CHI at Connolly. As the physical building progress at pace on the new Children's Hospital, there is an emerging need for a permanent name to be assigned to the hospital, as you've identified. A clear name and identity are essential for identification purposes to enable the organisation to raise awareness of the services and view the name with positive message association. The Minister for Health, Stephen Donnelly, is aware of this need and the importance of the name of the new Children's Hospital, and as such the process for naming the Children's Hospital is currently under consideration. I would like to conclude by noting that the new Children's Hospital is more than just bricks and mortar. It is a key enabler of strategic reform in the way in which we deliver health service for our children and our young people. This hospital and wider paediatric network provide right care in the right place at the right time for children and young people throughout Ireland. And the Minister is actively in consideration in terms of the process for the naming of the Children's Hospital, and that's currently and actively under consideration by Minister Donnelly, the process.
For your reply, and I want to thank everybody who actually, I should have thanked everybody who is still working on the construction of the hospital. That was remiss of me. It's just tremendous to see it coming out of the ground, and everybody who has worked on it is to be congratulated and commended. It is going to transform and just absolutely transform not only the provision of care for the patients, for the young people, 25% of our population, as you referenced, Minister, but also it's going to transform the work environment for everybody who works in the hospital. And I want to also just absolutely commend and thank, we can never thank and appreciate enough, those who work in our health services today. Not just in Crumlin and Temple Street in my own constituency in Dublin Central, but Tala and Connolly as well. The Mater, the Rotunda, everybody who works, you know, our GPs, they are fantastic, and our community nurses and that. In terms of the future of the naming of the hospital, I take encouragement, Minister, from your reply, because I do think it acknowledges and recognises that there is a name for a proper identity for the hospital, a naming of the hospital that is appropriate, that will not just represent the future of paediatric care, but also the values that will inform it. And those values are captured perfectly in the name Dr. Kathleen Lynn, the values of social justice, the values of equality, and the values of care for children and those who need it.
Once again, I'd like to thank Senator Fitzpatrick for her contribution on this matter, and I can see how passionate you are in respect of putting forward Dr. Kathleen Lynn as the name. This significant undertaking, which is the Children's Hospital project, shows the commitment of the government to develop paediatric services for children and young people. Dare I say, to further develop. This new Children's Hospital, the key enabler of the project, will be the hub in the national network of paediatric services. This network will support regional and local hospitals to deliver acute paediatric care close to home for children, providing more ambulatory care and integrated locally with community provision. The two supporting satellite centres, Connolly and Tala, which represent major milestones as part of the wider reform effort, are completely and fully operational. This hospital and the wider paediatric network will substantially develop children and young people's healthcare within the wider Staunton Care vision, providing the right care in the right place at the right time for children and young people throughout Ireland for generations to come. And as previously stated, and obviously the key element of your debate this morning, commencement matter, Minister Stephen Donnelly for Health, Minister for Health Stephen Donnelly is mindful of the importance of the naming of the new Children's Hospital, and as such the process for naming the new Children's Hospital is currently under active consideration.